Hi everyone, welcome to Med News India, your trusted source for reliable health updates and expert guidance. I am Dushyant Maggu and today I am joined by Dr. Deepak Thakur, a distinguished pediatric cardiac surgeon at Fortis Hospital, Manesa. Today we'll be discussing key aspects of pediatric heart surgery, surgical options and risk, latest advancements, and what parents needs to know when facing such critical situation. And before we dive in, don't forget to subscribe to our channel for more health updates. If your child or someone you love is facing a heart condition, I'm sure this discussion offers clarity and hope. Dr. Thakur, thank you for joining us today. To begin with, doctor, what inspired you to choose pediatric cardiac surgery as your specialty?
So pediatric cardiology, as basically you become a pediatrician first, then you become a pediatric cardiologist. So during my journey as a pediatrician, when we used to work in the critical care units, so the most common and the satisfying branch which we used to handle in our critical care unit was the cardiac ailments in kids. The best part of treating a pediatric cardiac case is that you are giving most of the kids a lifetime cure. So whatever treatment you offer to these kids, more than 95% of the congenital heart defects what these babies have got a lifetime cure in single operation or the single intervention. That is the most satisfying thing. And of course, handling the little innocent hearts who cannot speak for themselves, who cannot seek help for themselves, is always a blessing. Whenever you treat these patients, you always feel blessed. That gives a kind of a different level of satisfaction what you get. And the rarity of this branch, the rare doctors you find in this branch, I am proud to be one of them across in this country. Thank you.
For our audience, can you explain what congenital heart defects are and how common they are in newborns?
So congenital heart defect, as the term says itself, these are the defects which are present right from birth of the baby. These are the defects in the structure of the heart. The heart has got 4 chambers, 4 valves. There are walls between the upper 2 and the lower 2 chamber. There are vessels coming out of the heart. There are vessels entering inside the heart. So congenital heart defect encompass whole of the structure of the heart. So it is basically the structural abnormality of the heart. It can be in the form of a hole in the heart, a blockage in the vessel, a blockage in one of the vessels which is going out of the heart, or the valve inside the heart, or it can be a more complex problem like a particular chamber of the heart is not formed, particular vessels which are entering the heart are not entering and draining at an abnormal position. So these are the spectrum of congenital heart disease, right from simple defect like a hole in the heart to the complex of the heart defects where the vessels are not formed or abnormally draining. So this is a full spectrum of congenital heart disease. There are hundreds of diseases within this. The most common among these are the holes in the heart, and surprisingly, most of these holes in the heart just need one-time intervention or surgery. More than 90% of cases are a simple hole in the heart. Yes, of course, these holes will not show the symptoms right at the beginning of the life sometimes. Sometimes the baby keep on growing with this and later on the child starts developing symptoms. So one-time treatment will give the lifetime cure for these cases.
How early can such heart problems be detected? Is it possible even before birth through scans?
Yes, definitely. The fetal cardiology has come up in a big way. So as a fetal cardiologist also, I do intrauterine cardiac scans for the pregnant ladies. The best time to get the fetal echocardiography is between 18 to 22 weeks of the pregnancy, can be up to 24 weeks in India. But what the Western people follow, that is the standard 18 to 22 weeks of pregnancy. We can evaluate the heart completely and can tell whether the child is having any complex or a simple heart defects. Fetal echocardiography, yes, can be done, and these things can be detected early in the pregnancy.
When do you decide that surgery is the only option for a child? And how risky are these surgeries?
So as I told you earlier also, most of these congenital heart defects, more than 95% are the simple heart defects. Telling simple heart defect doesn't mean that it is not going to cause problem in child's life. I would like to explain the symptoms or the signs in a congenital heart defect child by taking a simple example what we see in adults. We all know about diabetes, right? the sugar, what we call ke sugar ki bimari or diabetes. So basically diabetic patient is moving around, he's roaming around, he's not paralyzed, he's not sitting, day to day activity he's doing, he might be having some letharginess or some excessive thirst or headache or blood pressure issues, but he's roaming around, right? The patient is absolutely fine. Now when a diabetic patient is roaming around, there are two ways that patient is going to land up to you. One is during the routine evaluation, he might come for cough, cold, fever or some long-standing infection, and you check, you see his diabetes is bad or he's got the diabetes problem, the sugars are very bad. You start the treatment there itself, you save the rest of the organs or you save the body of that patient. Other way the diabetic patient land up are in the emergency with the heart attack or with a stroke or with a kidney failure. At that time, when you do blood tests, you come to know that his diabetes was really bad. He was not taking care of a diabetes, or he didn't know that the diabetes exists also. Similarly, congenital heart defect children usually will be playing around. They'll be running around, they'll be playing around. See, kids are very innocent. They will only land up in mother's lap or on the bed once the heart will stop functioning, once the heart has started failing. So our point is to prevent the heart failure. Heart failure has to be prevented. Why? Because replacing the heart is a very long process and it's a very deadly process. It is a disease in itself. So basically we want to prevent the motor from failing. Simple hole in the heart or a big hole in the heart can be cured very easily with one-time operation or intervention. The primary purpose in these kids, what I'm talking about, the 95% of cases, is to prevent the child from going into irreversible cardiac damage. Heart cannot reverse itself. Once the heart muscles are dead, they are dead. It cannot be reversed. Liver can regenerate. Okay, intestines, you give rest, it can regenerate, but the heart is one of the organs which is never going to regenerate. So preventing the child going into refractory heart failure is the thing what I recommend, to detect these heart diseases earlier and get them cured earlier. That is the message through this video. Another thing is the second question, how risky are this surgery? As I told you, most of the congenital heart defects are simple heart defects for us, of course, not for the parents. Any heart defect is serious condition for the parents, but as a treating physician and as a treating cardiologist, the risk involved in these procedures are hardly 1 to 2%. 98 to 99% is the success rate. 1 to 2% is an accidental risk. So that is in the hands of the God. How to operate the child, how to get the child out of the surgery, how to take care of the baby post-op. These all things we know very well. We are the experts in this thing. Whom to operate, whom not to operate, we are expert in that thing. But 1 to 2% is the standard risk world over for any congenital heart defect you get operated.
Can a child lead a normal and healthy life after heart surgery?
Yes, of course. Any child who undergoes a heart surgery will lead a normal life like you or me, except for 1 or 2% of complex congenital heart diseases where particular chamber is not formed or a valve is not formed, the track between the heart and the body vessel or the lung vessel is not formed at all, where the child might need multiple stage surgeries. But yes, of course, these children also are mobile, they are functional, they'll be able to do all their day-to-day activities. So remaining 98%, the child is going to lead an absolutely normal life like you or me. The child will be able to do all the sports activity, all the recreational activity, all the adventurous sports, all the academic excellence, whatever he wants to gain. The child will lead absolutely normal life, 98% of the child. The remaining 2% of the child whom I am telling multiple stage surgeries are defined, they can also lead a normal life. But yes, of course, the expectation that the child will become a professional athlete or a professional bodybuilder, that should not be there with the parents. But yes, of course, the child will be doing good in academics, the child will be able to take care of himself, he'll be able to do bathing, toileting, dressing, undressing, and he'll be able to do some of the simple activities also like cycling, brisk walking, playing small sports for a brief period. He can do all those things.
So what are some of the latest advancements in pediatric heart surgery that you are excited about?
Yes, so the latest advancement, if I talk about, we will talk about the congenital heart defects. So minimally invasive interventions have come up where lot of Congenital heart defects which were needing surgery earlier can be done without surgery through intervention, where we need not open the chest of the child to operate. We can take an access from the leg vessel, go inside the heart, put a particular device. Latest equipments have come up, very tissue friendly, very body weight friendly, where the small size equipments can be used to enter inside the heart, put a device and come out, and we can cure most of these problems without surgery also. That is one thing. Coming to the surgical domain, yes, of course, there has been a lot of development on the surgical aspect. The surgical aspect development has now come into the era where we are using heart for treating heart. So if any particular vessel or valve is damaged which need to be replaced, so we are using the other valve which is functioning very well on the prime location of the heart, doing the root translocation surgeries which have come up in a big way, or using the child's own heart tissue to recreate that particular valve through Ozaki procedures. So these are the latest things which have come up in the surgical domain also. And the other aspect of the pediatric cardiac heart defects are, of course, the cardiomyopathy or the heart failure in pediatric age group. So there are latest equipments or latest devices which have come up. The Berlin heart or the XCOR is the latest in this domain, where the device can be implanted in child's heart and give rest to the heart let the natural heart recover itself instead of going for transplant straight away. So these are the latest development which have come up in this. And yes, of course, the post-op management of the pediatric cardiac patients have grown up exponentially. Lot of medicines have come up to give a rapid recovery from the post-op period. Usually our average length of stay in the ICU, most of these kids are hardly 48 to 72 hours. Within 3 days, we transfer the baby to the ward. So there are post-op medications, advanced medicines have come up, which can, accelerate the recovery period of these kids.
We really appreciate your time and expertise in helping us understand pediatric heart surgery better. We know that a heart condition in a child brings many worries, but today's medical breakthroughs and expert care means more hope than ever before. If your child is facing heart-related issues, we are here to help. Our team will help you to connect with top pediatric cardiac surgeons and leading hospitals to get the expert care which your child deserves. If you found this video helpful, don't forget to hit the like button and subscribe for more. Thanks for watching.